Hi and welcome to Medicine Past, Present and Future. My name's Dr. Nick and I'm the past.
And my name's Dr. Isabelle and I'm the future.
And together, we're the present.
Now, Dr. Nick, what's something that you used to get in trouble for as a kid that you now realise is totally harmless?
Quite a few to choose from. But the thing that really used to drive my mum mad was when I used to crack the knuckles on my hand. Because my mum had quite bad osteoarthritis in her hands, and she used to say to me, if you crack your knuckles, it'll give you gnarly old hands like mine.
But it's not true, is it, Dr. Nick? It might give some people the heebie-jeebies to crack their knuckles, but research has shown it doesn't actually cause arthritis.
You're right, because there was a Californian researcher who decided to crack the knuckles on one hand every day for 60 years while leaving the other hand alone. And at the end of 60 years, he took x-rays of both.
And?
There was no difference. So cracking your knuckles is fine. It's not going to give you arthritis. But Dr. Isabelle, there are loads of different kinds of arthritis, aren't there?
Yeah, that's right. 26 different types according to Arthritis Australia, although the more common ones are osteoarthritis and rheumatoid arthritis.
OK, so let's focus on those two. And they're not exactly new. I mean, there are Egyptian mummies which have been shown to have rheumatoid arthritis. So let's talk about that one. What exactly is rheumatoid?
So rheumatoid arthritis is an autoimmune disease, and what that means is that your immune cells get sent mixed messages and they go and attack your healthy cells by mistake. So it is often characterised by multiple joints and feeling worse in the morning.
Yeah, so if your joints are really stiff and sore in the morning, particularly the knuckle joints here, and then tends to ease up as the day goes on, that could be rheumatoid. But what about osteo?
So osteoarthritis is what's known as a degenerative bone disease. And what that means is that long-term use and wear and tear on the bones causes the degrading of the substance between them, the cartilage. Now, it's more common in women, older age groups, people with obesity and people with a family history of osteoarthritis. So what can be done about it, Dr. Nick?
Well, there's no particular cure, so prevention is really important. And the most important things for prevention are keeping weight under control and keeping the joints mobile, exercise. When it comes to treatment, it's mainly physical therapies, pain relief, and when things are really bad, joint replacement.
So let's talk about treatment for rheumatoid arthritis. Now, when I was at medical school, they told us that in the old days, they used to use gold. Now, what is all of that about?
It sounds really weird, doesn't it? But gold actually was a treatment for arthritis. Back in the 20s, they found that gold had anti-inflammatory properties. And otherwise, the only thing they had was aspirin. So gold was actually quite effective for some people with rheumatoid, but it had lots of side effects, and gold injections were really painful.
Now, luckily, we have much more sophisticated treatments these days. I would even go so far as to call them the gold standard.
Oh, come on.
Make you feel as good as gold.
Aren't I supposed to do the dad jokes?
It's a gold class experience.
That is quite enough. Thank you, Dr. Isabelle.
Thank you, Dr. Nick.